Self-care for the calcaneus. So I actually have an issue going this way with my left foot, and I'm not quite ready to use the banded technique so that I have the talus decompression happening at the same time. I need to actually work on the calcaneus to begin with without involving the talus at this juncture. So how do I know that? Well, this is pretty uncomfortable, it has to be said. There's a little bit of breath holding and I'm breathing a lot more shallowly. So our assessment tells us that there's something going on there. I'm also finding it quite difficult to drive with my calcaneus in this position, which is not what we're after. So using our position of ease to begin with, we can take it in the opposite direction. Now it's really important that when we're doing this, the foot tripod remains engaged. It'll be super easy to do this, but that's not going to actually achieve anything. So we need our foot tripod to be engaged, all 5 toes pressed into the ground, pushing down with our metatarsal heads as we drive backwards through here. We're just going to hold that in a position of ease. Remember, this should be nice and easy. Hence the name. It shouldn't be uncomfortable, certainly shouldn't be painful. We're going to hang out there for a little bit and then we're going to come back and we're going to see how that does, making sure that we're still driving through that calcaneus. It feels a little better. Yeah, feels a little better. But there's probably some more work that needs to be done there. I can do that separately when we're off the video. So we're going to use finger magnets at the same time. I'm going to come in here and I think we're probably, ironically, on the talus. And come in here as well. So because I'm inherently lazy, I do 2 things at the same time. So we've got our finger magnets on. I'm just going to take myself back into a position of ease. It's not full ease because I don't have that level of flexibility in my hamstrings. That's a whole different kettle of fish. We're going to bring that back. We're going to hold that there. Wait until they are ready to be done. This bit can take a little while and is not very good for video, but it would be worse for radio. Good. And then we're going to take that through. Still able to drive through the calcaneus, and I think that's a little better. It certainly feels more fluid. Bring that back again into a position of ease. Make sure that we're driving with our toes and our metatarsal heads. Come forwards, drive with that heel. And there we go. I hope you find the self-care useful.